When I have my patients into the office, I like to find out what's going on in their businesses. I'm fascinated particularly by what controversies exist in their industry. It's interesting no matter whether it's dentistry or I have a lot of aerospace employees. There's always something. There's always some major development or major controversy. And in dentistry right now, there's quite a few. One of the main ones is whether or not to use metal in the mouth. And when I say metal, I mean metal-supported crowns, like gold or any of the silver metal mixtures can be made into crowns. Or even more controversial is the use of amalgam in the mouth, which contains mercury. Mercury dental amalgam has been used for years, and it's very well supported by the ADA. And their official position is that it's completely safe to use in the mouth. The interesting thing about mercury amalgam and where the controversy comes from is that a lot of patients are becoming very savvy that it does contain mercury, and as they're being required to turn in their mercury thermometers to their local pharmacy, or when they find out that mercury amalgam fillings are outlawed in other countries, then they ask the important question, well, now why is it okay here? Why are we still using it here? And I don't really feel the need to convince people or to try and change anybody's opinion. I simply answer that I don't have those fillings in my mouth anymore, and nobody on my family tree has them anymore. It's become obsolete in my practice. I haven't used the mercury amalgam fillings since 1995. So what do I use instead? There's a lot of materials now that I feel are better and more biocompatible, and they have the added benefit of looking like a tooth. When I restore a tooth with amalgam, it's pretty obvious that I've been there. There's a black filling there, so it's pretty obvious that something was done to that tooth. But today, when I use one of the more biocompatible tooth colored materials, then when I've restored the tooth, it's undetectable. For example, a lot of patients who come to me to have anterior crowns placed, crowns on the front teeth, will have a silver line right at the gum line that makes the tooth look dull, dead, or decayed. But a lot of times that is, it's just an aesthetic concern for them. Well, the new crowns have porcelain bonded directly to the tooth, so there's no metal interface. We don't need that metal, which was used for strength. We don't need that anymore today. Another example is that I have crowns, veneers on two of my front teeth, and you can see that you can't even tell which two they are. There's no metal along the gum line anymore. So I'm not even going to tell you which two it is. You'll just have to guess. The other concern I have with metal in the mouth of any kind is that metal is inherently reactive when it's around water. So if you take a mercury amalgam filling and you put it in the mouth, you're putting it in a wet environment, bathing it in saliva all the time. And that sets up another factor. Additionally, metal amalgam fillings don't have the same properties as tooth. And really, the only thing that has the same properties as tooth is tooth. Enamel or dentin is what we call those layers of the tooth. Amalgam acts differently. And so when we have amalgam inside a tooth, it actually causes cracks that due to the expansion and contraction of that material. And this particular filling was behind a front tooth that wasn't even being bit on. So you can see that the tooth, why did it crack? There was nothing, no forces on that tooth other than this amalgam filling that was in the middle of it. And all of those cracks radiated out as that filling over the years and years that it was in place changed properties. So anyway, the new materials, they look like tooth. They're more biocompatible. They're prettier. And so I just don't see any reason to use these other materials anymore. I don't fault dentists who use them. If their patients want it and they're comfortable providing it, then so be it. But in my practice, it's one of the controversies that I feel strongly we have new, better materials available. I hope that clears things up for you.